More than 300 communities across 21 local government areas in Kogi State get free medical care. The government says it is to ensure indigents, especially those in rural areas, are not left out of development. The medical services include free eye checks, diagnosis, treatment, and drug administration for both adults and children. The governor of the state, Yahaya Bello, is asking the local government councils to make their full autonomy count by ensuring that the people at the grassroots enjoy the dividends of democracy. The program was also monitored and supervised by the State Ministry of Local Government and Chieftaincy Affairs, headed by the Commissioner Abdul Salam Didat Ozigi in collaboration with the local government areas through the Office of the Auditor General Local Government, Mr. Usman Ododo.
For more on this, Kingsley Fanwo, Kogi State Commissioner for Information, joins us now. Great to have you on Newsday. Would like you to tell us more about this free medical treatment.
Thank you very much. Good afternoon, Arise, and good afternoon to the viewers around the world. We want to express our satisfaction with what the local government areas in the state are doing at the moment. We appreciate the fact that because they were granted autonomy immediately the governor came into office in 2016, they are living up to that expectation by ensuring that they provide services to the good people of the state, like the health outreach that you are watching on your screen right now was put together by the 21 local government councils in the state. This is to ensure that healthcare services reach the hard-to-reach areas in the state. And that is bringing a lot of succor and a lot of welfare and well-being and wellness to the good people of the state, especially people at the grassroots level.
Now, is the project fully funded by the government? And does this have anything whatsoever to do with the 2023 elections coming next year?
Oh, no, not at all. Yeah, you know, our local government councils have been rendering services to people at the grassroots level. If you listen to, I listened to your report in the morning on this, and one man from Agbaja is one of the very, very difficult places to reach in the state because of the terrain. And, you know, the man said that what they usually witness is during the election, politicians will come to that particular football pitch to come and campaign. But now what they are witnessing is that government is coming to give back to the people. And that's quite plausible. You would also see that this is fully funded by the 21 local government councils in the state to ensure that they take care of the healthcare needs of the people. It has nothing to do with 2023. We are just in January 2022, and they have been rendering all of these services over the past few months and years. You know, some 2-3 years ago, the local government councils procured tractors, which were distributed to the 21 local government councils to enable farmers practice mechanized farming. That's why you see Kogi doing very well in the production of certain crops. We are still the leader in the production of cashew. We are still the leader in the production of cassava. These are the things that we are doing differently that is giving us edge over other states. So it is not about election. It is about the need to serve our people, and we will continue to serve them whether there is election or no election. This is not election period, but you could see that we are still in the business of serving the good people of Kogi State.
Regardless, the effort is commendable, but we want to know how long the project is running for and how long it will run for, since 300 communities are benefiting from it. Is it something indefinite, or is it for a year, a couple months?
It is a process, you know, and I can tell you that we've gone around the 300 communities. It is not one team, you know, it's something that was happening simultaneously across the 21 local government councils in the state. And this is what was put together by the ALGON and also supervised by the State Ministry of Local Government and Chieftaincy Affairs under the leadership of the Honorable Commissioner of that ministry. And also the Auditor General's Office for Local Government is also ensuring that we have prudent utilization of resources at that level. You would agree with me that Kogi is one of the few states to have signed the local government audit bill into law because we want transparency at that level. That level used to be the cesspit of corruption and malfeasance in the past. But you could see now that we have been able to bring sanity to the place, and even people could track their resources, and now they are benefiting directly from what is coming to the local government council. So it is a process. It is something they have been doing. They partnered with the state government on the operation Light Up Kogi East, where several communities are being lit up in the Eastern Central District of the state that is reputed for not having the kind of power supply they should enjoy. Also, I've talked about the tractors that were supplied. Also, they have been doing a lot in health intervention. This is not the only one. They've been doing a lot in health intervention, rollback malaria and all of that. So it is a continuous thing when you talk about the healthcare needs of the people.
Now, we know that the Kogi State government has a door-to-door healthcare initiative. Apart from this free medical treatment, what else is the government doing to improve the health sector in Kogi State?
Thank you very much. I think the local government councils are taking a cue from the magnificent healthcare projects that we are putting in place in the state. Right now, there is what we call the reference hospital that we are building at Okene in the central part of the state. That hospital is going to be the best in the country in terms of the architectural design and the facilities that we are putting into it. I can tell you that we have brought in all the facilities that we put there. So as soon as the construction is completed in the next couple of months, it will become operational, and it is going to serve also as the teaching hospital for the COSTECH. That is the Confluence University of Science and Technology, Osara. We are also having all of these healthcare facilities across the state. In the Western Central District, for instance, you have at Gegu and also at Isolu for Yaba Federal Constituency and for Lokoja Federal Constituency. We have also been able to upgrade the General Hospital in Kaba to a specialist hospital. You can also see what we have done in Ida in the eastern flank of the state. We're also building a teaching hospital for the Prince Abaka University, Ayamba. So when you look at the state at the moment, it is like the healthcare tourist center of the nation. So it is massive because it is one of the thematic areas of the IRBU administration. So we are massively working on ensuring that all these facilities become operational in the next couple of months, when we will bring Mr. President to get him busy commissioning project after projects.
All right then, Kingsley Fanwo, Kogi State Commissioner for Information, we thank you very much for coming on the program to discuss free medical care in Kogi State. Many thanks.